Hello, everyone. I am Camellia, a psychiatric mental health nurse practitioner, also known as a PMHNP. I am also a nursing and mental health enthusiast. And so I wanted to get on here first to share a little bit of my nursing story, but also I wanted to thank you guys for engaging with me thus far. I've had a lot of you ask me questions. I've had a lot of you to really comment and offer your own sort of experiences. And so thank you guys for the engagement here. I look forward to continuing to talk with you guys, chat with you guys, share information. This channel was actually developed to really share the role and the experience that I've had thus far as a PMHNP. I have been in nursing since 2006, and I have worked in quite a few places during my tenure in nursing. I obtained a bachelor's degree right away, so I knew that nursing was what I wanted to do. Started out in a stroke telemetry unit, went from there, loved neuro, started working in a neurosurgical ICU, did that for quite a few years. Then I became a nurse educator, obtained a certificate in nursing education, and I was working at that time in nursing professional and organizational development. So just teaching classes as far as continuing education classes, new hires for the organization. And then I decided that I missed patient care, just to be completely honest. And so I went back and started working in a place called virtual critical care. It was a great experience. It was sort of a new thing at that time where telehealth was sort of just getting going. And from there, I was required to go back to work in the ICU. So I did some part-time hours there. And then I landed a PRN job in behavioral health, and I've never looked back. I went from PRN to part-time and then became a weekender in an acute care inpatient behavioral health unit. And during the time, about a few months before I started my master's program, which I knew I wanted to do, I actually started working on that unit. And so my experience sort of went hand in hand with what I was doing with patients. Of course, I wasn't working as a provider at that time, but it was valuable to be able to work with patients from a mental health perspective, gain some insight as to how to communicate with patients, how to deal with crisis situations, because there's a lot of that management of crisis situations on the inpatient side, and really just helping to hone my skills with therapeutic communication. And so I started school in the master's program in 2015. I then moved on to graduate, of course, in 2017. I've done clinicals in every area, but I landed my first job in 2017 for a large organization where I was the first mental health nurse practitioner that they hired for the outpatient world, and I worked outpatient psychiatry as my first job. Loved it, and I have loved it. I've been in outpatient to some degree since then, but then I decided that I wanted to move on to explore private practice, and at that time I did do that, and I've been doing that ever since. So I've done also the emergency room. I transitioned to that at the same time as private practice, and it also offers quite a different experience, and it still really kind of keeps me afloat, keeps me challenged, keeps me thinking, so I do enjoy that as well. So I work in a behavioral health emergency room in addition to telepsychiatry and outpatient private practice. So I have enjoyed my nursing tenure. I only share that because you guys may want to know how I got to where I am, what prompted me to decide to become a PMHNP. And so just being able to serve in a space of providing care to patients, which has been my basis for nursing, and mental health care allows me to do that, and being a provider. So that has not gone away. I've been able to just fine tune that, refine those skills, and really feel like I'm offering the best that I can for patients. But I do want to offer this time to say thank you to all of the bedside nurses out there. I work in the hospital setting, occasionally in the emergency room, but I do know that you guys are enduring quite a bit at the bedside. I also have a twin sister who is a family nurse practitioner. She works inside the behavioral health unit, and she has had quite a few stories for me during this pandemic. So I could not go forward with this video without saying thank you to those that are serving anyone in healthcare right now. I myself am a part of that, but I do know that there is a level of commitment, sacrifice that is currently at the bedside. So I want to remind you guys that you in nursing, a lot of times we feel slighted, and I know that's been really a thing lately, just from some conversations I've had with other nurses. But just reminding you guys that you aren't just a nurse. You have so many skills, so many positive attributes about you that got you to where you are. And so just to offer a little bit of encouragement, I decided to wear this t-shirt today. And the t-shirt says, not just a nurse, but a life-saving, I don't know if you guys can see that, human with brains and compassion. So it just highlights, it makes a bold statement that first, as nurses, we're human. Secondly, we've worked hard to get to where we are, but also for us to remind ourselves to not take the passion out of compassion. So again, this video was about my journey as a nurse, but also so that you guys can understand sort of where I come from and why this is still near and dear to me, but also offering the encouragement for those that are along this pathway. Maybe you're wanting to be a nurse, you're unsure about it, maybe you're wanting to be a PMHNP. So this channel, again, was created just for that, for a space for us to talk about things, to learn about things, to explore things together, and most importantly, to stay positive. So you guys, I'm hopeful that you'll continue to stay around with me, continue to learn and grow together. And I look forward to engaging with you guys more as I continue to share information and videos. Thank you.